From the turkeys and ham to the holiday desserts and cookies, it can be very difficult for someone with diabetes to stay on track this holiday season. So we've brought in Jean Kostak. She's going to tell us some easy ways to make substitutes for all those yummy things during the holidays. You are a registered dietitian for the UConn Health Center's Diabetes Education Program, right?
That's correct.
Okay, where do we need to begin here? What do people need to know about diabetes?
I think it's really important that they're mindful about their diabetes throughout the holiday season. And remember that the holiday is really just the one day, but the rest of the month there's other parties that we need to...
Oh yeah, we snack all month long.
Right, perhaps do some things that we can stay on track. And one of them is exercise. Okay. If they're in a regular routine to do exercise, stay in that routine. Perhaps even exercise a little more often if they're going to be eating a little more often as well. So exercise not only helps burn calories, but also helps to lower blood sugar. So we're really important to stay on the exercise routine, as well as checking blood sugars a little more often. So the stress of the holidays, the shopping, the running around can cause some stress, which can increase blood sugars as well. So what we're trying to do here is check the blood sugars a little more often, before the meal, after the meal, at times when you're not perhaps eating as well as you should.
Can you tell our viewers some of the symptoms maybe of diabetes, if maybe they may have it and they don't even know?
Sure, and that's very common. There's a lot of people out there that have diabetes that don't know it. But if you have a family history of type 2 diabetes in your family, you are higher risk. The symptoms would be increased thirst, increased urination, a little more tired. You're not using the glucose that's in your body because you're not producing enough insulin to get that glucose into your cells so you can have some that energy. So really those are probably the first two, increased urination and increased thirst.
And of course if you have any questions you can always ask a doctor or maybe get yourself checked out.
Absolutely. Anyone over 40 really should be getting tested for diabetes every year.
What are some of the problem foods during the holidays then that patients need to look out for that could cause some problems for those with diabetes?
There are some problems with certain foods if they eat too much of them, but really there is no foods that they don't have to avoid anything if they choose to eat a little less of it or perhaps make some switches in the ingredients that they put in them.
And be smart. You brought a nice display for us today, so let's kind of work our way down the table here.
So these are just some of the nice low-cal, low-fat items that we sometimes choose. One of the things I like to do for an appetizer is instead of sour cream, we're using non-fat Greek yogurt. Tastes just like sour cream. I've mixed some dill and some Worcestershire sauce in that dip, so we're a little higher in nutrients because there's more protein in the yogurt. And then some fresh vegetables or some low-fat crackers would be a great appetizer.
And dill is just great to give anything a little zest if you need a little taste to something.
Right. And then when it comes to the main plate, we want to really think about portion control. Fill up half that plate with those non-starchy vegetables like broccoli and salads and really healthy green or carrots, asparagus, that kind of thing. Protein goes in one corner and your starch goes in the other, and you've got a nice well-balanced plate with foods that you enjoy but controlled portions.
And you said there's nothing that they really have to avoid. You just have to do it in portions, which is good advice for anybody, whether you have diabetes or not. Portion control, right?
Correct, absolutely. You know, the sweet potatoes, they have carbohydrates. They'll increase the blood sugars, but if you have the right amount throughout the day, your blood sugars will stay in check.
Okay, now this next plate just looks absolutely delicious, but you said it's made a little bit differently.
A little bit differently. Instead of the oil, which adds lots of calories and fat, we've added sweet potatoes. And that's kind of a little bit different, but it gives them more moisture. It does give you a little more carbs, but you've cut your calories down about 100. If you had 2 brownies, about 100 calories less than what you normally would have had.
Now, Brad Drazen did try one of these earlier today, and what did he say about them? Tell us.
He thought they were delicious. He said maybe kids wouldn't like them, but he thought they were great. My 16-year-old, she liked them just fine.
I can't believe he got in here and grabbed one already. How do you like that? Okay, so sweet potatoes then, instead of the oil, when making a typical, just normal box of brownies.
Right. You still have carbohydrates. You have to count the carbs and know how many are in there, but they are a good substitution to decrease calories.
Good stuff too. Okay,
absolutely.
Great. And then
the next thing I have here is our crustless pumpkin pie.
It looks great.
Really good, really tasty. What we've done there is we've taken our regular can of pumpkin, just like you see here, a can of pumpkin, follow the directions, but instead of sugar, I've used Splenda, which is really the only sugar substitute that you can use in baking with that keeps its taste. The other thing we've used is non-fat milk. You could use a non-fat evaporated milk as well. A fat-free evaporated milk is a nice choice. And then also instead of the eggs, I've used egg substitutes. So another good choice to keep it lower in fat and lower in sugar.
And I'm I'm sure people can go online too if they have any other questions, right, to find substitutes for different meals if maybe none of this is appealing to them right now.
A great place to go is the American Diabetes Association website. That's another wonderful resource for people with diabetes.
Wonderful. Jean Kostak, thanks so much for being here and bringing this all in. We appreciate
You're very
the
welcome.
information.
My pleasure. Thank you.